Separation anxiety disorder is the most prevalent anxiety disorder in children younger than 12 years old, and it's thought to occur in approximately 4% of children and 1.6% of teens. Welcome back, Straight Talkers. Today, I'm going to talk about the diagnosis, separation anxiety disorder, and how psychiatrists go about making this diagnosis clinically. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Separation anxiety disorder is listed under the section Anxiety Disorders in the DSM-5. Prevalence decreases as we go from childhood to adolescence to adulthood, but there are still some adults who will meet criteria for this diagnosis despite the majority of children growing out of it over time. It's important to remember that it's developmentally normal for children to have periods of heightened separation anxiety from their attachment figures. Remember when your child was around 1 to 2 years old and had stranger anxiety? This was considered to be totally normal and expected. Those who develop separation anxiety disorder will typically start to show symptoms either in preschool or the elementary years. So the essential feature of separation anxiety disorder is excessive fear or anxiety concerning separation from home or attachment figures. So in evaluating for separation anxiety disorder, there are 4 criteria that psychiatrists take into consideration, and these are listed from criteria A to D in the DSM-5. Criterion A is the longest, and it states that there needs to be developmentally inappropriate and excessive fear or anxiety concerning separation from those to whom the individual is attached. And this is evidenced by at least 3 of the following 8 symptoms. 1. Recurrent excessive distress when anticipating or experiencing separation from home or from major attachment figures. 2. Persistent and excessive worry about losing major attachment figures or about potential harm happening to them. And this can include things such as illness, injury, disasters, or death. And many times, parents will tell me that their child will need to know their whereabouts at all times, right? And they'll want to stay in touch with them throughout the day. So this can usually result in excessive phone calls and text messages. 3. Persistent and excessive worry about experiencing an untoward event that causes separation from major attachment figures. And this can include things such as fears of getting lost, being kidnapped, having an accident, or becoming ill. 4. Persistent reluctance or refusal to go out, away from home, to school, to work, or anywhere else because of fear of separation. 5. Persistent and excessive fear or reluctance about being alone without major attachment figures. And this can be at home or in other settings. So children with separation anxiety disorder often struggle with being alone in a room by themselves. And they'll display either clinging behaviors towards the parent, or they'll even stay close to them while the parent's moving around the house and will shadow them. 6. Persistent reluctance or refusal to sleep away from home or to go to sleep without being near major attachment figures. So many children will require a parent to stay with them in their bedroom, right, until they fall asleep. Or if they wake up in the middle of the night, they'll end up winding up in their parents' or even their siblings' bed. They'll do things such as refusing to attend summer camps or sleepovers with friends. And it's not uncommon for some children to report unusual perceptual experiences when they're alone at night. Many will tell me that they see people peering into their rooms, or they see frightening creatures reaching out for them, or they feel as if eyes are staring at them. And if symptoms are present in adults with separation anxiety disorder, they will often describe being uncomfortable with things such as traveling independently and sleeping in hotels. 7. Repeated nightmares involving the theme of separation. And this can include destruction of family through fire, murder, or other catastrophes. And then 8, repeated complaints of physical symptoms when separation from major attachment figures occurs or is anticipated. And these symptoms can include things such as headaches, stomach aches, nausea, or even vomiting. In teens and adults, common symptoms can include increased heart rate, dizziness, and feelings of faintness. So if the various criteria for criterion A are met, I will then screen for criteria B through D. Criterion B states that the fear, anxiety, or avoidance is persistent, typically lasting at least 4 weeks in children and adolescents and more than 6 months in adults. Criterion C says that the disturbance causes clinically significant distress or impairment in social, academic, occupational, or other important areas of functioning. So a lot of times patients will struggle with things such as becoming homesick, and it's to the point where it can cause misery when away from home. And in children, I commonly see things such as school refusal, which then in turn can lead to academic difficulties and even social isolation. And these symptoms also typically take a toll on the whole family and can be a major source of frustration and conflict. Lastly, Criterion D states that the disturbance is not better explained by another mental disorder. So examples of this could include things such as refusal to leave home because of excessive resistance to change in something like autism spectrum disorder, delusions or hallucinations concerning separation and psychotic disorders, refusal to go outside without a trusted companion and agoraphobia, worries about ill health or even harm befalling on significant others and generalized anxiety disorder. Now head on over to the next video to find out more ways that you can help your child live their best life.